Today is the Drug Enforcement Administration's National Drug Take Back Day. This is an event that is not only happening in the Baton Rouge area, but all over the country as well. It's an important event because it's our opportunity to clean out our medicine cabinets. Back in the 70s, drug abuse began on the street, but now we know that drug abuse begins in the home. It begins when a child, a grandchild, a visitor to our home comes into our home and finds unused, unwanted, and expired medications and takes them, unfortunately. So we don't want that to happen. If you have an injury or an illness or a surgery and you have medications, particularly opioids, we need you to get them out of your medicine cabinet. And today is how you do that. So we were here at Baton Rouge Police Headquarters from 10 a.m. until 2 p.m. The DEA takes all of the medications that are collected at these events and safely disposes of them so that they don't get into the wrong hands. It's a very serious problem. In 2020, our country saw more overdose deaths than in any other time in history. We truly are in the middle of a crisis. This is a war, and we are not winning this war. But events like the one that we're doing here today at BRPD are the solution. The solution is we all clean out these drugs out of our medicine cabinets and we safely dispose of them so that they never make their way into the wrong hands.
Well, this is the Drug Enforcement Administration's 21st National Drug Take Back. We've been doing this now for approximately 11 years and we've had great results. People always ask, what can the community do to fight the drug epidemic? And right now we have 93,000 people per year we're losing to drug overdose. That's over 250 a day. Part of our strategy, along with the enforcement side, is community outreach. And the community is always asking, what can we do? How can we get involved? Well, this is one step where the community can get involved in ridding their homes of these prescription and over-the-counter drugs that linger in the home medicine cabinet. We know around 4 million Americans are addicted to prescription drugs. And this is just a great way for people to get rid of these unwanted, unused prescription and over-the-counter drugs that languish in the home medicine cabinet. And we believe by doing this, it's a step in the right direction to making our communities safer. Because DEA, we're about saving lives. And again, this is a great opportunity for the public to come out and help us in fighting the drug overdose epidemic. Well, we're seeing it across the United States. We're actually seeing pills out on the street right now, counterfeit pills that are laced with fentanyl, and 1 out of 5 of these pills has a lethal dose of fentanyl in it. So we're seeing people overdose on these counterfeit pills that are on the street right now. And again, we're losing over 250 people per day to drug overdose. So it's paramount that we do whatever we can to make our communities safer. Fentanyl is a synthetic opioid that is 50 times stronger than heroin and 100 times stronger than morphine. Just a few milligrams of it can be lethal. Well, we have over 4 million people addicted to prescription drugs in this country right now. So it's a grand epidemic. We also have the fentanyl right now that is lethal. So I mean, we have the counterfeit drugs out on the street that are disguised to look like the pain medications, and then we have the pain medications that are being sold on the street.
Unfortunately, we have seen a trend in the community and across the country called farming, but this isn't farming with an F, this is farming with a PH, pharmaceutical. What happens is our teenagers have a big party, and where I used to pay a cover pay when I went out, these teenagers, when they go to the parties, their cover pay is a handful of medication that they have taken from the medicine cabinet with no regard for what they're grabbing. They may grab birth control pills, cholesterol medicine, opioids, heart medication, chemotherapy drugs. They don't care and they don't know. They go to the party, they drop everything that they brought with them into a big bowl, and then when the party begins, they mix the bowl up and everybody just takes a handful of what's in the bowl. This has resulted in overdose deaths all over the country. It is a very serious problem. It's a crisis.
We have boxes stacked as high as you can see, and we just want to thank the community for their participation, along with all the partners with Baton Rouge Police Department, and we look forward to continuing this in years to come. This is something that we've been involved with from the beginning. Baton Rouge Police Headquarters has been one of the collection sites for as long as I can remember, and we want to keep that partnership with the DEA, Blue Cross going. As you can see, people are coming in and out since it started at 10 o'clock this morning. The amount that we have collected so far is very impressive. People are listening, and we want to continue that partnership with the organizations along with the community.
The Attorney General's office is committed to this pandemic, or this epidemic rather, of opioid addiction that we have in this country. It's something that the Attorney General has been on from day one of taking office. So we partner with Blue Cross Blue Shield on several different projects: Drug Take Back Day, permanent drug take back boxes. Jeff Landry, our Attorney General, really believes in private-public partnerships, and so things like this are very important to him. This is always such a great event, and today's no exception. It's really crazy when you stop and think about the number of prescription drugs we have laying around in our homes, and so many people who misuse opioids start with someone else's prescription, so it's very important to get rid of them.
At Blue Cross, our mission is to improve the health and lives of Louisianians, and this is a big way for us to do that. We have found that these events collect enormous amounts of medications. At our event in April, we collected over 1,600 pounds of medications, much of it opioids, that could have potentially found their way into the hands of, again, a child, a grandchild, a pet, someone who visits the home, or worse, ultimately to the street. So we really do make a difference with these projects. We partner with the Baton Rouge Police Department, the DEA, the Baton Rouge Health District, Acadian Ambulance, the Louisiana Ambulance Alliance, and all of these other companies across the city, and this is happening across the nation as well. So all of these companies are banding together to make a real difference. We do not want you to simply throw medication in the garbage can. We also do not want you to flush it down the toilet. That is something that we hear very often at these events is, oh, I'm not worried about it, I just flushed it down the toilet. There is a significant amount of drugs in our waste systems, wastewater systems. So please don't do that. We don't want to see anything go down the toilet or in the garbage can, because someone can always get it out of the garbage can. So please make sure you safely dispose. If you weren't able to make it out to our event today, we have permanent drug drop boxes all over the state of Louisiana. Blue Cross partnered with the Louisiana Attorney General's office and a national organization known as the National Association of Drug Diversion Investigators, and that effort is in the process of placing a permanent drug drop box in law enforcement agencies across the state of Louisiana. I think we have about 14 parishes left that do not currently have a box, but we're trying to get to those parishes as quickly as possible. If you don't know where our boxes are, you can always go to the Blue Cross website, and we have a map that will tell you where all of those permanent drug drop boxes are. Now, let's say you just can't leave your home, but you have medications that you need to dispose of. There is a safe way to do that. The best way to do that is to take a plastic bag, fill it with something undesirable, leftover food, coffee grounds, anything like that. Pour the medication in there, add some water to the bag, seal the bag, let it sit for a little while so that everything in there dissolves, and then just throw that bag in the garbage can. That's a safe way that you can dispose of drugs in your home if you can't come out to one of our events or to one of our permanent drug drop boxes.
Baton Rouge Police Department has a permanent drop box right through our headquarters. To the left, it looks like an old mailbox. It's white. It's marked as a drop box. So you can either dispose of those items as you collect them, or you could wait for drug take back events, which are in the spring and the fall, April and October.
Oh, they are collected and then they are taken to an EPA endorsed incinerator where they're destroyed.
I brought all kinds of medicine. I emptied bottles and bottles of old expired medicine, dumped them all in a bag, the ones that were in little packs. I didn't punch through, I just put those in a separate bag. I got stuff that was so old, I'm embarrassed to tell you, so I'm not.
What's your advice to other people?
This is so easy. There's not even a line here. You just drive up, you drop off your medicine, they give you a bag, you drive away. It's safe. You don't have to worry about old medicine in your house if you have children. It's definitely not safe to flush them down the toilet, put them in the water system and all that kind of stuff.
I came today because they advertised on television that they was taking drugs back, and today happens to be my daughter's birthday, and my husband passed away in 18 and she passed away this year in June, so I didn't know what to do with the medication. I didn't want to put it in the garbage or the toilet, so I brought it out here so they can dispose of it correctly.
How much medication did you bring?
2 boxes.
What's your advice to other people?
I advised them to do the same thing I just did. Bring your medication to the drop-offs or wherever they can dispose of them properly.
Today I brought various medications from prescription pain medications to allergy medications from across about 15 years of keeping medication.
What do you think of this program?
I think it's great to do. Holding on to medications or flushing them actually into the water system is hazardous. When you have kids in your home, such as we do all the time, we're concerned about children getting a hold of any of the medications and causing harm to themselves.
We drove from Marpaw to bring in some drugs that we are no longer taking due to either allergies from them, allergic reactions, or the doctor changed medications.
I brought some narcotics. My sister had double knee replacement earlier this year, and they had given her some oxycodone, I think, which she did not need. She didn't take them, and so we were just bringing them over here to get them out of the house, and nobody was going to ever take them, and I didn't want them to ever fall into the wrong hands or something bad happen with them, so you don't want to throw them down the drain, so we decided to bring them here and have them properly disposed of.
What's your advice to other people?
I think you should do the same, just to keep medication in your house, especially narcotics after surgery. They always give you a prescription and you fill it, and a lot of times you never take it, and then it's in the house. And not that anybody in your house is going to take them, but you just don't want, somebody, a workman or somebody come in that may have a problem with addiction that would find those pills and take them. So it's better just to get them out of circulation.
I brought in some medications for diabetics, and the reason I brought it in is hopefully it'll be able to help someone that may be not able to afford to get their medications.
What's your advice to other people?
If you have something sitting around that you're not using any longer, bring it by. It takes about a couple seconds to drop it off.
I'm from Praireville, Louisiana. I was looking forward to the drug take back day. We've been hanging on to a lot of old, expired, and narcotics, and just didn't want to throw them in the garbage can.
What do you think of this program?
Oh, I think it's great. It gives everybody an opportunity to drop off things so that people don't come into the house and take, drugs that might cause a problem down the line.
We've had great results here today. We always have good results. That's why we continue to do this.
Baton Rouge Police Department has a permanent drop box right through our headquarters. To the left, it looks like an old mailbox. It's white. It's marked as a drop box. So you can either dispose of those items as you collect them, or you could wait for drug take-back events, which are in the spring and the fall, April and October.
If you weren't able to make it out to our event today, we have permanent drug drop boxes all over the state of Louisiana. Blue Cross partnered with the Louisiana Attorney General's Office and a national organization known as the National Association of Drug Diversion Investigators, and that effort is in the process of placing a permanent drug drop box in law enforcement agencies across the state of Louisiana. I think we have about 14 parishes left that do not currently have a box, but we're trying to get to those parishes as quickly as possible. If you don't know where our boxes are, you can always go to the Blue Cross website, and we have a map that will tell you where all of those permanent drug drop boxes are. Now, let's say you just can't leave your home, but you have medications that you need to dispose of. There is a safe way to do that. The best way to do that is to take a plastic bag, fill it with something undesirable, leftover food, coffee grounds, anything like that. Pour the medication in there, add some water to the bag, seal the bag, let it sit for a little while so that everything in there dissolves, and then just throw that bag in the garbage can. That's a safe way that you can dispose of drugs in your home if you can't come out to one of our events or to one of our permanent drug drop boxes.
I read that Blue Cross was going to try to partner with all the parishes to set up permanent places where drugs can be brought back, and I think that's a wonderful thing for any insurance company to be involved in, to ensure that people are being safe.
I think it's great that Blue Cross is involved with this, and they've always been great supporters of health care and healthy living in Louisiana, and it's a great thing, and I think it's good that they help sponsor this, and I hope it gets a lot of the narcotics and opioids off the streets. We have a lot of problem. I'm a social worker, and I used to work with patients who had problems with opioid addiction, and it's nice to have somebody helping to try and curb the problem of opioid addiction in Louisiana.
I'm super excited about this event. I'm a Blue Cross employee, and it's one of the reasons why I love my company, because Blue Cross is out there in the community really trying to make a difference. And it's so great to partner with national organizations like the Drug Enforcement Administration, our local police department here at BRPD, and we're just able to make a difference in the community. So I'm excited about what we're doing.
How can people get more information?
They can get more information on the Drug Enforcement Administration's website, DEA.gov, and on the Blue Cross website as well.